I'm Kai Wang from Southeast University in China. It is a great honor to present our research at IEEE VR 2025, titled Mixed Reality Assistance for Acupuncture Guided by Ultrasonic Computed Tomography. Our research integrates mixed reality and ultrasonic computed tomography to develop an innovative real-time guidance system. We aim to revolutionize acupuncture training and clinical practice with this technology. Let's explore its potential together. First, let's discuss the significance of acupuncture. As the cornerstone of traditional Chinese medicine, acupuncture has been practiced for millennia and is widely used to treat conditions such as pain and nodal disorder and digestive issues. According to the World Health Organization, acupuncture is recognized in over 100 countries and has demonstrated efficiency in managing chronic pain. However, acupuncture practice faces several challenges. Medical students require extensive trial and error to gain proficiency, which is inefficient. For example, beginners may take months or years to master deep acupoint localization. Practicing on volunteers can lead to infections and injuries. Trainees cannot visually confirm whether the needle has reached the target acupoint, making accuracy assessment difficult, especially in complex anatomic areas. Introducing MRUCT, let's examine the limitations of current methods. First, human model training. While safe models cannot replicate real tactile feedback or anatomy, limiting learning outcomes due to the individual anatomic variations on real patients. Lack of real-time guidance. Most systems have been developed primarily for acupuncture teaching and offline training. MRUCTs fill this gap by displaying acupoint locations and needle trajectories in real time on actual patients. Now, let's explore the design and functionality of the MRUCT, which seamlessly integrates ultrasonic computed tomography with mixed reality. The system operates in two methods, offline registration and real-time guidance, ensuring precision and safety in acupuncture operations. First, for offline registration, the UCT scanning takes about 3 minutes, followed by a 2 hours reconstruction. For slice alignment, we aim to minimize the row list and improve the imaging quality by adjusting the spatial alignment between slices. For eliminating the artifacts, we have adopted the segment anything model to extract the region of interest. For downsampling, we decrease the resolution to speed up the registration process. Given the considerable size of the dataset and the need of AI algorithmic precision, we employed LDDM for long-range registration, and the objective of image registration is to identify the optimal and the smallest information filed that aligns the template image with the corresponding anatomic structure on the target image. For real-time guidance, the implementation of our MR systems includes 3 core components: a bracelet tracker with 4 retroreflective markers facing in 4 directions, a detectable needle tracker, and an optical see-through head-mounted display, and a Kalman filter was integrated to minimize noise and reduce jitter in tracking performance. The reference insertion trajectory is automatically computed from entry and endpoints right circle. Once the needle contacts the patient's arm, users start to insert the needles and stop based on reference to another anatomic structures. We also compare our UI with the 2-ring systems adopted from previous studies, where the radius of the ring indicates how far the needle trajectory is from the entry or endpoint along the trajectory. For evaluation, we establish technical validity through anatomic registration accuracy and system error analysis firstly. Second, we conducted comparative studies with with 31 participants across expertise levels. Finally, we quantified clinical outcomes and utilized a 7-point Likert scale, the NASA task load index, to indicate the qualitative results. This comprehensive method ensures our findings are both statistically robust and clinically relevant. Focusing on RQ1, our LDDM algorithm achieved remarkable precision. While muscle registration scored lower at 72.33%, this actually reflects clinical reality, where muscle boundaries are inherently ambiguous. This level of accuracy enables reliable 3D model overlay, crucial for safe needle guidance. Before evaluating the system performance on real patients used by actual medic students and acupuncturists, we evaluated the end-to-end tracking accuracy of MRUCT, and the average error from 12 data points was before. Focus on RQ2. MRUCT is transformative for experienced practitioners. As shown in Table 1, the MRUCT method performs best, minimizing errors in both the entry point error and end point error accuracy metrics. Reducing the produced time, this demonstrates its potential to help experts perform acupuncture tasks more effectively and accurately for safe and effective acupuncture practice. As we can see, the MRUCT method shows a smaller error distribution for both entry point error and end point error metrics, showing a lower median and narrower error interval in the box and the whisker plot, close to experienced doctors, which demonstrates that it can help medical students with minimal training perform acupuncture tasks correctly. Excluding quantitative results, we asked participants their preference of using MRUCT or the Turing navigation systems, and an overwhelming majority, 30 out of 31, opted for MRUCT, and we can see that the MRUCT achieved significantly higher SUS scores than the Turing, demonstrating its higher usability in clinical settings. Comparing the preference of doctors with students, a higher percentage of doctors enjoyed the intuitive design of MRCT, 7% higher. A higher percentage of students believe that MRCT can help with their learning of acupoints, 3% higher. In conclusion, we present MRUCT, a system combining ultrasonic computed tomography and mixed reality to visualize acupuncture points in real time, addressing the challenges faced by novice practitioners. The system provides offline image registration and real-time guidance for accurate needle insertion based on anatomic structures. We detail long-range registration methods for UCT data and key MR systems design considerations. Evaluations with 2 3D user interface show improved performance over traditional workflows for new practitioners and medical students, highlighting MR's potential to enhance acupuncture practice and facilitate clinical training. Though MRUCT has some limitations, like the small number of experienced acupuncturists in the tester user group and the lack of diverse patients in the clinical validation, we believe that MRUCT has the potential to revolutionize acupuncture guidance and contribute significantly to the development of acupuncture doctors with further advancements and refinements. Thank you. That's all of our work. Thanks for your lesson. We welcome partnerships for clinical trials and system refinement.